आलोक सर।
सर भाई ये वो नहीं चेंज हो, प्रेजेंटेशन मोड में क्यों नहीं जा रहा?
आप सर एक काम करिए, थोड़ा सा ये इसको स्टॉप शेयर करिए, थोड़ा स्टॉप शेयर करिए, इंटायर स्क्रीन फिर से शेयर करिएगा। स्टॉप शेयर करिए।
अच्छा,
हाँ, अब इंटायर स्क्रीन शेयर करिए, वही शेयर के ऑप्शन से
अच्छा
इंटायर।
इंटायर स्क्रीन।
हाँ
हम्म,
हाँ, स्क्रीन मिनिमाइज कर दीजिए।
दिखा?
हाँ, अब ये प्रेजेंटेशन मोड करिए। अब ओके है सर।
ओके, so very good evening to all of you. Myself, Dr. Alok Singh, working as Assistant Professor Veterinary Medicine at ANDUT Kumarganj, Ayodhya. Today, Meadow Agriculture give me opportunity to share my insights about the topic Ethnoveterinary Medicine, Traditional Healthcare Practices for Livestock. So we started. So first of all, a question arises in our mind that what is ethnoveterinary medicine? So ethnoveterinary medicine basically deals with the community-based knowledge, practices, and beliefs that are very useful to treat livestock illness. Beside this ethnoveterinary medicine is must also be sustainable, cost-effective, and accessible alternative to the modern pharmaceuticals. This ethnoveterinary medicine, or we can say abbreviate at EVM, is a very common practice in the areas where the availability of modern veterinary medicine is rare. That's mean in the village area or rural area where modern veterinary facilities are not available. So on that particular area, this EVM is very fruitful. Now, after knowing what is ethnoveterinary, there are now we comes to know that what are the key benefits associated with this EVM. So first one is reduced AMR, that is antimicrobial resistance. Second one is treatment efficiency. Third one is safety and sustainability. Fourth one is biodiversity preservation, and fifth one is cost effective and accessibility. So in nutshell, we can say that these are the five key benefits which are associated with the EVM or ethnoveterinary medicine. Cost effectiveness and accessibility. As we have discussed that this EVM is often cheaper and more readily available than conventional treatment, making it ideal for rural livestock owner. Because as we previously told that this EVM is most beneficial or most useful in those areas, in those rural area or village areas where the modern veterinary facilities are not available. So it must be cost effectiveness, because at rural area the poor farmer is not able to bear such costly medicine or costly modern pharmaceutical. So on that cases, this EVM must be cost effectiveness and it should be accessible. Now the second one is reduced antimicrobial resistance. As we know that in the present scenario, everyone is suffering from this antimicrobial resistance, and at each apex research centers or colleges, there is a general talk that how we should reduce this antimicrobial resistance. So this EVM is a good tool that can be helpful in reducing the antimicrobial resistance. Next is treatment efficacy. Not only it is cost effectiveness and accessibility, but it is also its efficacy also very good. In certain cases, we come across that out of 29 chronic mastitis cases, we successfully treated 27 by the help of this EVM, that is ethnoveterinary medicine. This implicates that it has better treatment efficacy. Now, safety and sustainability. Again, it is environmentally friendly and often has fewer side effects than the chemical medication. This again makes highlights its importance of EVM, that it is safer and sustainability. Now, biodiversity preservation. We have recently learned too much about that there is a depletion of biodiversity and so on. This is a negative effect on the nature. So this EVM is very helpful in conserving the biodiversity, because in EVM we use certain herbs, we use certain plants. So directly or indirectly, it compels us to conserve the nature. So it promotes the documentation and preservation of local medicinal plants. Now, next one is what are the various key practices involved in EVM. Although there are various practices which involve EVM for their therapeutic management, but out of them, these 4 are most important, like diarrhea, mastitis, skin infection, injury, and wound. These 4 areas, these 4 broader areas are too much dealt by this EVM. Although there are certain other areas where we can successfully use the EVM. After that, we now know what are the major herbs or items that are used for formulation of or making any EVM ethnoveterinary medicine product. Although there are so much medicinal plants which are successfully or frequently used to make various ethnoveterinary products, but out of them, 4 are very important, and these are frequently used, like aloe vera, neem, tulsi, and turmeric. Now, after knowing the EVM, next one is traditional healthcare practices. This traditional healthcare practices encompass 2 things. One is herbal treatment, and other is physical and managemental practices. And these should be discussed in the PPTs. Now, next one is traditional healthcare practices for livestock. What are the various traditional health care practices that are followed in various parts of India for the well-being of the livestock and the concerned stakeholder, out of which first one is digestive disorders. And digestive disorder is the most important and frequent clinical conditions which we encounter at veterinary clinics. Out of which the bloat is the again very important clinical condition or disease condition in case of ruminants. So for the treatment purpose or for providing therapeutic management to the sufferer, there are various ethnoveterinary medicine products available in the market and successfully used at the village by the villagers at the village level. And those preparations should contain either one ingredient or various type of ingredients. Like for the therapeutic management of bloat, we successfully use ajwain, ginger, turmeric, asafoetida, either singly or in combination. Besides this, diarrhea and dysentery are another digestive disorders which are frequently encountered at clinics, and for their treatment we use pale pulp of bale, mango seed kernel, tender leaves of guava, and as well as pomegranates. Besides this, bloat and diarrhea, dysentery, indigestion, constipation, and anorexia are other few conditions which encountered frequently. For addressing the issues of indigestion and constipation, we should use herbal masala boluses, and these herbal masala boluses are formed by using black pepper, cumin, and jaggery. And for anorexia, we should use seed of Tachyspasmum emi, which is ajwain. Ajwain is a Tachispermum emmi, or the bark of Termilla chibula, to stimulate appetite. So by the use of various medicinal plant, we can successfully handle the cases of indigestion, constipation, and anorexia among the various animal species. Now, next one, after digestive disorder, we comes to the infectious disease. In case of animal practices, there are various infectious species which can be either due to the bacterial origin, which can be either due to bacteria or viral mostly. However, there may be fungal infectious diseases also, but we generally encounter with bacterial and viral origin infectious disease, out of which the FMD, which is also known as Khurpaka and Mupaka, it is a very important disease, viral disease of ruminant, in which the major clinical signs associated with are there is a formation of lesions on the gums and buccal mucosa of the said animal, as well as lesions on the foot. And the lesions are so much grave that the animal suffers from pain and unable to swallow the feed, as well as unable to walk properly. So giving them therapeutic management, we can use various medicinal plants like turmeric, aloe vera, and honey. So we can use aloe vera and honey, mix and make a gel, and can apply the lesions at the buccal mucosa and the tongues. This paste provides soothing effect to the animal, and turmeric has antimicrobial property, and this turmeric can be applied at the lesions at the foot of the animal. In the same way, hemorrhagic septicemia is another infectious disease of bacterial origin, and it can be managed by the use of herbal decoctions, which this herbal decoction includes garlic, pepper, and specialized bark of Albizia amara. Albizia amara is a mimosa or silk tree. So by combining this garlic, pepper, and specialized bark of Albizia amara, we make a herbal decoction, and this herbal decoction can be used for the therapeutic management of hemorrhagic septicemia. Beside this, there are various other infectious diseases like pox, anthrax, and blue tongue disease, especially in case of sheep and goat. And this blue tongue disease can be successfully therapeutic management by the use of aloe vera pulp. Now, after infectious disease, there are various parasitic infestations which encounter the animal species. There are two types of parasitic infestation. One is ectoparasiticides, and other is endoparasiticides. So in case of ectoparasiticides, there are ticks, mites, and lice, and for their remedial purpose, we can use neem oil, tobacco stalk decoctions, or Ennona squamosa crushed leaves. Ennona squamosa is a custard apple. So neem oil, tobacco stalk decoctions, and crushed leaf of custard apple can be successfully used to get rid of the ectoparasites problems. Meanwhile, there are various endoparasites which were classified as tapeworm, flatworm, and roundworm. Roughly they are classified, and they are also known as internal worms. So for getting rid of these internal worms, there are various medicinal plants which can be used, like aloe vera pulp, neem seeds, and Andrographis paniculata, which is known as green chiraita. Andrographis paniculata is known as green chiraita, and neem seeds, green chiraita, and aloe vera pulp can be successfully used to get rid of these internal worms. Next one is few other conditions. There are beside this, there are various other conditions like eye infection, poisoning, and milk fever. Eye infection, in case of eye infection, which is conjunctivitis or cataract in case of animals, and this can be successfully managed by the use of root decoction of Barbaris aristata. In case of snake bite poisoning, we can, for their management, we can use mixture of betel wine, tulsi, and ginger. Meanwhile, milk fever, a condition which arises due to the deficiency of calcium. So, the calcium deficiency can be improved by offering lime water or calcium hydroxide to dairy animals. So by using these small practices, we can minimize the various disease clinical conditions or various disease conditions among animals. Now, another most important disease condition of milch animal is mastitis. There are variety of ethnoveterinary preparations, ethnoveterinary medicine preparations available in the market and frequently used by the various stakeholders at rural area or village area. Out of them, the standard formulation of aloe vera, turmeric, and lime paste. It is a very important and very successful mixture. When we use this mixture, we successfully treat the mastitis case. Here we take fresh aloe vera leaf, about 250 grams, turmeric powder 50 grams, and calcium hydroxide 15 grams. We take a blender and blend out the fresh aloe vera leaves, and after that mix turmeric powder and calcium hydroxide. So by mixing these three items in a given quantity, we make a paste. When we made a smooth paste, we apply this paste to the particular sufferer animal. Before application of this paste, we should we must wash the udder and teats of that particular sufferer animal, and this paste, after washing that area with lukewarm water, we apply this paste, and this paste is often diluted with water or mixed with 150 or 200 ml of mustard or sesame oil. For better consistency, apply this paste 5 to 10 times a day for 5 to 7 days. This is an external application. Meanwhile, along with this external application, there should be an internal dosage of 2 lemons twice daily for 3 days. So this is a complete treatment protocol for the successful management of mastitis. Beside this mastitis, there are certain cases of teat obstruction. So this teat obstruction can be better managed by using neem, turmeric and ghee mixture. So there we take a fresh neem leaf stalk, and this leaf stalk should be painted with turmeric powder and ghee mixture, and after that application, this stalk should be carefully inserted into the teat opening of that particular sufferer cow. By doing this, there is a improvement in the milk flow of that cow. So in this way, we can successfully manage the teat obstruction case. Sometimes there are various cases we reported at clinic that there is a blood in the milk. In mastitis case, particular owner reported that his cow gives a milk mixed with blood. So on that cases, we use 30 gram curry leaves and 100 gram jaggery, makes a mixture and offer this mixture to the animal, and this will successfully treat the blood in milk condition. In case of mastitis, there is a severe inflammation of the udder. For treating the severe inflammation of udder, we can use aloe vera gel or Mimosa pudica, that is known as touch me not plant leaf paste. by making this paste, we apply this paste after cleaning the udder. This paste is successfully manage the severe udder inflammation. Now, application guideline. Whatsoever various ethnoveterinary practices I have discussed in previous must be follow this guideline before their application. There must be complete milking. There must be proper hygiene, and the frequency of application of this ethnoveterinary preparation must be 5 to 10 times in a day for fast results. Because sometimes we see that in village level, farmer oftenly applied the ethnoveterinary preparation but can't maintain the hygiene. So without maintaining the hygiene or without maintaining proper hygiene, these ethnoveterinary preparations can't give a desired result. So getting desired result, we must compile with this application guidelines like complete milking, maintenance of hygiene, and frequency for 5 to 8 times in a day. Now, next important condition which normally frequently encountered at veterinary clinic, that is diarrhea. So as in mastitis, there are various ethnoveterinary formulation available in the market for the treatment or for the therapeutic management of diarrhea, and each preparation contains either one ingredient or more than one ingredient or a bulk of ingredients, bunches of ingredients like turmeric, ajwain, guava leaves, and coconut products. These are various ingredients which are oftenly present in various ethnoveterinary preparation which are helpful in treating diarrhea. One of the effective remedies for the treatment of diarrhea is using 50 gram of isabgol, which is known as psyllium, in a liter of water. We soak them, and after soaking this 50 gram of isabgol in a liter of water, we should offer to the sufferer animal. Beside this, we can make a paste by using 10 gram of cumins, fenugreek, pepper, turmeric, and garlic along with jaggery. We make a paste and offer to the animal. This is a very good ethnoveterinary preparation, helpful for treating the providing therapeutic management for diarrheic cases in cattle. Besides this, there are various other ethnoveterinary preparations like handful tender leaves of pomegranates and neem and so whatsoever. There are various. And again, I want to tell you that before we should provide any ethnoveterinary medicine preparation, we must follow the administration guidelines. So in case of diarrhea, the administration guidelines are generally 100 ml to 500 ml of these preparations are given orally, depending on the concentration and size of the animal. Frequency. Treatment are often administered twice a day, with some requiring 3 times a day for 1 to 3 days. And in case of coughs, the dose required is half of the adult animal for calves and sheep and goats. Now, next condition is skin disease. Again, skin disease are also very frequent cases. For the treatment of skin disease, there are various medicinal plants like neem, turmeric, garlic, aloe vera, betel leaves, and ghee. These are successfully either used separately or in combination to get rid from the skin disease conditions. For wound and skin infection, we should use neem and turmeric paste, acacia gum paste, betel leaf, and black pepper paste. So by using these pastes in given appropriate amount, we can successfully therapeutically manage the wound and skin infection case in case of animals. For mange, lice, and ticks cases, we should use annona leaf or seed paste and camphor and oil. Camphor mixed with coconut oil is used to treat lice and ticks cases. Again, there are preparation and usage guidelines for skin disease like base material, application method, and frequency. Again, the next disease condition is lumpy skin disease. We recently encountered this disease in various states or various parts of India. So there is a ethnoveterinary preparation. There are various ethnoveterinary preparation for therapeutic management of lumpy skin disease. These preparations are of two types. One preparation refers for external use and other preparation for internal use. Because the treatment of LSD mainly focuses on boosting immunity and treating skin lesions. So for boosting immunity of a particular sufferer animal, we should make a herbal combination and offer it to the sufferer animal, which helpful in increasing its immunity. And beside this, herbal preparation, which is helpful for increasing immunity, can also given to the healthy animal. In case of healthy animal, it increases its immunity, so the healthy animal not able to so healthy animal can be get rid from this lumpy skin disease. The animal which is suffering from lumpy skin disease, for external lesion, we should make a paste by the use of neem leaves, turmeric, and garlic. And for immunity purpose, we should make an oral mixture by the use of betel leaves, black pepper, jaggery, and cumin. These remedies are widely recommended for mitigating symptoms. If maggot develops in sores, apply enona, that is custard apple leaf paste, or camphorated coconut oil. The key components and their uses: neem and turmeric. As we know that neem and turmeric act as antimicrobial and antiseptic agent to prevent secondary infection in skin lesions. Betel leaves and black peppers known to have anti-inflammatory and analgesic properties. And jaggery is used as a binder for oral medicine or providing energy to weak animals. So there are various other immunity booster, wound healing, that external application. There are various so many ethnoveterinary products are available. Now, after lumpy skin disease, the other important case is milk production in cattle. Often, various stakeholders came to the veterinary clinic and they ask that they should please provide us some medicine which are helpful for increasing the milk production in their animal. So in case, we should use herbal galactogags like Savitri, Ajwain, Moringa, garlic, fenugreek, and fennel in various combination. So for increasing milk production in animals, we should use herbal masala bolus, garlic neem paste, acacia leucofolia formulations. After that, the reproductive care or reproductive cases are another important one for dealing this. The important reproductive case is estrus or delayed heat. So for maintaining or for providing therapeutic management of estrus, we should provide herbal combination like Moringa oleifera, aloe vera, curry leaves, radish help stimulate ovarian activity and trigger heat. Beside this, this delayed heat can be managed by feeding germinated Bengal gram 200 gram for 1 week is commonly used to induce heat in cows. Now, beside this estrus, repeat breeding is another very important condition. So repeat breeding can be therapeutically management by giving juice of aloe vera. We can use in Rajasthan, ajwain is frequently used with water to treat repeat breeding. And in case of Andhra Pradesh, red mud mixed with egg white and water is successfully used to treat the repeat breeding cases. Now another condition is retained placenta. So for the retained placenta management, we should advise to the stakeholder that they should give bamboo leaves to the cow to trigger the expulsion of retained membrane. And there is a tribes in Rajasthan which successfully use sugar cane leaves, grounded rice, and mahua seed for retention of placenta management. Postpartum and fertility care. Feeding a mixture of ajwain, jaggery, and dry ginger after calving. It is helpful in expelling the placenta and provide energy to the newly parturiated cow or newly parturiated animal. Beside this, guava leaf extract combined with buttermilk is also very useful for providing better uterine health to the newly parturiated cattle. Now the various herbs that are used for reproductive care, they have a specific role, like aloe vera. This is very useful in repeat breeding cases and provide uterine tonic. Moringa oleifera, which is also known as drumstick, it is rich in antioxidants and minerals to trigger stress. Curry leaves, these regulates hormonal imbalances. Ginger, used to increase sperm count and motility in male livestock. And Tribulus terrestris, which is also known as gokharu, Tribulus terrestris, it is useful in expelling the placenta. Now, another condition is fracture. There are various traditional healthcare practices for treating the fractures and broken horns. These methods often focus on reducing inflammation, immobilizing the injury, and accelerating healing through natural ingredients. And horn fracture or broken horns, these are common in cattle and buffaloes, and these can be often treated by sealing the wound to prevent further infection and securing the horn. A traditional method is applying fully boiled rice over the broken region, followed by securing the area with human hair and covering it with termite clay. There are various herbal pastes and poultices for successful management of therapeutic management of horn fracture and broken horn cases, like haldi hai, and there are so many. Now, important considerations and precaution for the treatment of bone fracture. In warm months, wound dressing powders are necessary to prevent fly strikes. Traditional practices, while often effective, can lack aseptic conditions, requiring through cleaning of wounds to prevent septic conditions, and limiting the movement of the injured animal by isolating them in a small, soft, bedded pen is a critical component of traditional management to ensure successful healing. So these are reference, that's all. Thank you.
Thank you so much, sir. Any participants have any query?